My patient was a 85-year-old Caucasian man who was admitted to the hospital on March 14, 2021 for a closed fracture on left femur. He is on a consistent carb diet. He had surgery on March 19th for his femur ORIF with distal plates and screws as he fell at home. Subjective data from my patient was when I was doing his assessment and giving his medications. He's saying, I am having pain in the heel of my foot and it's stinging and burning. He also said he was a pastor for 10 years. Also, he said, I would prefer not to take Miralax. Some objective data I found, which is values, were his AST was 23, his ALT was less than 5, his sodium was 136, potassium was 4.0, glucose was 91 after lunch and after breakfast. His hemoglobin was 8.9 and his hemocritic was 27.2. Some initial findings I found was my patient was very sleepy when I walked into the room with the nurse to introduce myself. Then we exited so he could sleep. He was on 3 liters of oxygen with a nasal cannula. Before walking into the room, the patient was on fluid restrictions of 1,500 milliliters. I walked into my patient's room around 8:20 to get his vital signs, and he was alert oriented ×4. But his pain level was a 5 out of 10. He was calm, cooperative, and listened and followed commands and very talkative. Patient was wearing dentures and had surgical incision on his left femur with an aquaseal dressing over it. Some priority problems of a patient: he's at risk for a pressure ulcer, impaired skin integrity, and acute pain. Patient will maintain adequate hydration to decrease risk of pressure ulcers. Patient will ask to be repositioned in the bed. Patient will take pain medicine PRN. Patient will maintain good hygiene. Patient will keep wound incision clean, dry, and intact. Patient will understand the needs to clean the incision site and care for pressure ulcers to decrease inflammation and infection. The intervention needs: the nurse will educate the client on proper nutrition, hydration to help with skin integrity. The nurse will teach the client and family about prevention on pressure ulcers. The nurse will reposition client every 2 hours. The patient's dressings will be changed per order to decrease contamination, and a nurse will evaluate the effectiveness of the medication. Everyone's emotions. My patient's emotions were very good. He was tired, but obeyed commands, listened, was calm and cooperative when doing an assessment, giving meds, and other skills. The nurses were very nice and supportive towards us as nursing students today. They were very busy, but we as nursing students helped out with any task that was handed to us. Some responses and changes to the plan. My patient was alert and oriented the whole time on A2A today. When getting his first set of vital signs this morning, he was drowsy, lethargic, and wanted to fall back to sleep. But once I got him to wake up, he was talkative and wanted us to help him get comfortable. I want the patient to understand more about the medications he is taking while in the hospital and give him more patient teaching on how to prevent his pressure ulcers and help him get more range of motion slowly after surgery on his left femur. Some skills I performed today were head-to-toe assessment, moved the patient up in the bed, assisted with pericare, administered medications. I took vital signs twice, inspected the right heel, and found a stage 1 pressure ulcer. Effective communication from today. The nurses had very effective communication on the floor today as to asking us if we had administered an IV already or given meds. They answered every question we asked, very detailed and understanding. The nurses were collaborative with information. Patients were very active on the floor today and had some call bells go off to assist them. Differences in the plan from today. For my shift today, differences in the plan that I could have done was be more confident with answering questions that my patient had. I could have helped my patient do daily hygiene and tried to ambulate him to sit in his chair rather than his bed. Another thing I wish I could have done was encourage my patient to eat more breakfast, but more the result of his lunch. He improved on his appetite. With my patient, I could have talked more about his priority problems and how he could work on them. Some pros for my skill performance: having therapeutic communication, assessing pain level of patient, helping out the nursing staff with skills, encourage patient to eat his food, administer medications, elevated patient's right leg because of his pressure ulcer. Some cons: being more confident answering questions from my patient, finding different options to help patient be more comfortable in the bed from his surgery, and giving more patient education. Overall, I believe my second week on ATA was very relaxing and I was confident until I had to give medication. After I was in the room and talking about the medications and getting step-by-step instructions, I felt better about administering the medications to my patient and more comfortable. I thought I was very efficient on the floor, helping with tasks and building trust with my patient.